The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. With us today, we have Las Vegas's go-to guy when you want a world-class smile, Dr. Mike Golpa. Dr. Golpa, welcome to the program.
Thank you. Thank you for inviting me.
Now, before we get into today's topic, tell us a little bit about your practice, because I guess you do a lot of different things.
Well, we do a lot of full mouth reconstruction, cosmetic, and included in the full mouth reconstruction, there's a lot of times that we have to place implants.
Now, are the patients getting older and older that are getting cosmetic dentistry?
There are all types. You know, there are all types of patients that want to get veneers done. You know, even patients who are 50, 60 years old, they want to improve their smile, they want to improve their lifestyle.
All right.
They want to be able to socialize and, you know, start dating.
Now, you don't look like a dentist. Do people tell you that?
Well, what do I look like?
Well, I don't know, some other profession. I mean, I feel like you're too cool to be a dentist. But, I mean, you have definitely a sense of style. When did you know you wanted to be a dentist? Was it you were in college? And you always knew you wanted to be a dentist?
Yeah, before I went to dental school, you know.
Like in high school?
I always wanted to, you know, do something with my life that be able to help people, you know.
Okay.
And, you know, getting a beautiful smile and being able to improve their lives and their self-esteem, and it's combination of artistry and science, and I love that, you know.
You're an attention to details kind of a guy.
Yeah,
I spoke to Tammy at your office.
Well, you know what?
Everything counts,
in dentistry, everything counts. Every smallest micro details makes the big difference, you know, in dentistry especially, you know.
Okay, now when I think of, you know, cosmetic dentistry or veneers, I think of actors or news people doing it. You say everyday people.
Everyday people, you know. I think if it improves your self-esteem, your smile, your, you know, if the patient needs a full mouth reconstruction, if it gets rid of the headaches and the neck pain and the jaw pain.
Now, when you mention full mouth reconstruction, you know, and you say these are patients, I guess, that come in and their mouth is a mess.
Well, they come in, they have worn teeth, they have, they frequently get headaches and they don't know what is causing it. They get neck pain, they get jaw pain, they have periodontal disease. Their bite is all shifted. So the main thing
you fix those things and then do the veneers?
Yeah, exactly. The main thing to consider is the bite, if the bite is in the right position. And once we calculate where the bite, ideal position should be for the bite, then we'll go ahead and, you know, prepare the teeth for either veneers or crowns, or if the patient has missing teeth, we'll just place implant.
So dental implants?
Dental implants.
I mean, sometimes somebody comes in for cosmetic dentistry, you have to do a combination of dental implants and veneers?
Combination.
Oh, is that right?
Because I'm totally against doing a bridge. So I'd rather just replace a bridge with an implant. That way, you know.
And the implants can look real.
The implant can look completely cosmetic. Yeah. Well, everything I do is cosmetic. So, you know, once we place the implant, we make sure that the emergence profile from the gum looks completely natural, and you know, you have to make sure the structure around the implants are healthy, and in order to preserve the bone, the implants will actually help to preserve the bone around adjacent teeth. So
now you're going to show me photos, but I want to ask you this question. In a few moments we'll go to those photos because it's pretty dramatic stuff. Anybody watching this, they've got to stay to watch the photos. But so are there people that their mouths are just too far gone that they're not candidates for? I mean, for, you know, cosmetic dentistry?
There are people who are thinking that their mouth is too far gone, and they either have to extract the teeth and go to a denture or a full mouth implant.
Okay.
But a lot of times you will be able to save these teeth. You know,
but this is your specialty. I mean, this is what you do.
Well, if the teeth is salvageable, and that's you know, that's what I do. I do a full mouth reconstruction. I make sure what's the ideal treatment for the patients.
Okay.
Either we have to place an implant, or if we have to extract the teeth, or if we have to put the veneers on the tooth. So full mouth reconstruction, you know, has a lot of benefit for the patients. Not only, you know, it will alleviate the pain that they were suffering for a longest time, the headaches, jaw pain, jaw popping. But the bonus to all of it is they're going to get a beautiful smile once they're done.
You see a lot of people don't smile.
A lot of people.
Now, I don't hear the stories, but you're a dentist. I mean, do they come to you and say, I haven't smiled in years?
I see them all the time. They come to me, they don't know how to smile because they've been always trying to cover up their their teeth. You know, they don't smile, they're not being socialized, they're shy, they don't have the self-confidence.
But after they get their smile,
but
do
after
they
get the smile, oh my God, yeah.
Like they transform?
They transform, you know, I mean, they get executive smiles, and they'll be able to get promoted at their job, they'll be able to socialize better. And,
but you're a dentist, of course you think teeth are important.
Of course, having a beautiful smile has a big impact on the patient's life, you know, being able to smile. People who smile, they look happier, they look
That's
better.
True, good point.
And study shows that the people who smile more, they're more successful in their business,
Is that right?
in their relationship. Yes, of course. I mean, it's like something that it changes their whole appearance. Beside the clothes that they're wearing, beside, you know, the makeup that they have, the beautiful smile has a big impact in a person's appearance.
Now, what are the different categories of cosmetic patients, if you had to categorize them, that you see?
Well, there are different patients. One that are, you know, they have really bad smile, they have worn teeth and chip and discoloration. And then there are ones that they have pretty good smile, but they just want to improve it. They want to have that billion-dollar smile.
Okay.
And the third category is the ones that jaw has been shifted and they have grinded their teeth down all the way, and they have so much neck pain and headaches, and they're suffering from TMJ and jaw popping.
And you could take care of that?
Yeah, we can take care of all that with the
But what about somebody tells me,
reconstruction.
Randy, problem with veneers, if you're a teeth grinder, you get veneers, they're just going to chip off.
They're just going to chip off, yeah, because,
so what's the answer then?
Because the position of their bite is not corrected.
So you can fix that?
So we can fix that. That is actually the first thing that we have to consider when we are placing veneers on anybody. So
Okay.
the first thing to consider is if their bite is in the correct position.
We're going to take a quick break, and we're going to look at those photos. I mean, those are good photos. You didn't doctor those up at all? Okay, because they do look good. And, you know, you make a statement that you do more cosmetic dentistry, full mouth reconstruction, in 1 month than most dentists nationwide do in a year.
Well, yeah, I mean, it
not an exaggeration?
Not an exaggeration. I do more full mouth reconstruction than
most guys?
Most guys, you know.
Is there that much to learn? By the way,
there's
cosmetic dentistry.
There's a lot to learn, you know. I mean, it takes a lot of practice to get to where I am right now, and you know, I've done so many of these cases.
Do you develop a better eye over the years, by the way? I mean, I mean, when you do construction, you know, look at a mouth today.
Yeah, it's definitely you know, I'm much better now than when I was 12 years ago. You know, but you know, I've done so many of these cases.
What should somebody look for in a cosmetic dentist?
One should look in their training, how much training they had, and how many cases they do per month. If they have any implant background, if they are going to be
you think that's important, that they should know about dental implants?
That is extremely important, because you don't want to go ahead and if someone has a bridge, you don't want to go ahead and replace it with another bridge. So, or if somebody you know, has a bite issue, you don't want to go ahead and restore them or put veneers on the same position that they are right now, because those veneers are going to fail.
Okay.
So it's not a matter of how good they look, it's just, is it going to be functional throughout the years?
But before and afters, people always ask me, Randy, who should I go to? And I try not to refer any particular doctor. You know, people need to know also, this is a real interview.
You know, you should refer him to me, you know?
Yeah, I mean, this is a real interview. I mean, nobody's scripted here. But my question to you is, I mean, isn't it about the photos? I mean, you'll know them by how good their work is? I mean, isn't that important too?
Well, one thing you got to realize, if those photos are they're actual patients. Because there's a lot of companies out there that they would sell photos that these dentists could use, and before and after.
You didn't bring any of those photos, did you?
No, I didn't.
These are all your patients?
Yeah, these are all my patients.
Good.
All the patients that I have in the advertising, they're all my patients. The ones that are on the walls are all my patients. So
good.
I have all the before and after. Some of them I can, some of them I can't show it on, you know, in your show.
They're very private, very successful people.
Yeah, they're very successful people that, you know, patient confidentiality is
okay.
basically.
We're going to take a quick break, come back, and we'll look at those photos.
Right.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are with the dentist in Las Vegas that everybody seems to know and talk about when it comes to getting a billion-dollar smile. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. My first guest needs no introduction. He is Las Vegas's most popular cosmetic dentist, Dr. Mike Golpa. Dr. Golpa. Okay,
Randy.
so you brought some of your work.
Well, I brought some of the pictures of my patients. With this patient, she never was happy with her smile, and
she has a pretty nice smile.
She's got a pretty nice smile, but she wasn't happy with the canines, with the eye tooth, and they're pointy. They were crowding on the left side, and they were cross-bite, meaning the right side of the jaw was the teeth were too far in on top comparing to the lower teeth. So
when she comes to you and you're there on the consult, what do you see when you're looking at this?
Well, what we see is basically the arch on top is very narrow. We need to widen the arch. The teeth need to be lengthened just slightly because to follow the lip curvature, we always consider the lower lip line to see exactly how the relationship between the lower lip and the upper teeth.
So on this before photo, okay, you want those teeth to follow the lower lip? Is that what you're saying?
That little change by lengthening the teeth and widening the arch and following the lower lip line, it's going to change her smile from having a good smile to a world-class smile, which you can see it on the after picture.
Beautiful.
And she was a model, but in all her picture that she was taking previously, she wasn't smiling. And
you said you have a picture of her.
I have a picture of her.
Not smiling as a model.
Not smiling, and she's got this different pose. In none of them, she's smiling, because she was just so...
It bothered her.
Yeah, it bothered her. You know, she was always concerned about it.
So help me understand. Okay, so I look at this after. What am I looking at? What makes that such a great smile?
What you're looking at is basically is the length of the front central teeth, and then looking at the lower lip line, and looking at the smile line, we can see more teeth in the back on the corner of the mouth, which basically gives the patient a more positive smile. And now she's gorgeous. She's just beautiful. So happy. She's so happy. Now let me show you this. I mean, we get patients who have pretty good smile, but they want to notch it up. Now, Randy, I want you to just look at the before close-up shots of her teeth.
But she has a great smile.
She's got a good smile, but then she was in a dental field, and she was embarrassed from her smile because her
so she was pickier than most.
Yeah, she was so picky, and she didn't want to have all these chipped teeth, and you can see the corner of the mouth. The upper arch was very narrow, and that will give a patient a negative smile.
So what did you do for her?
What we did is we went ahead and we put upper veneers. We did corrected her bite. Her bite needed to be opened up.
All right.
So look at the bottom teeth. We went ahead and did the upper veneers already, and then the lower teeth was the one that was standing out because it was so imperfect. You know, it wasn't. It was a lot of crowding.
So veneers on the bottom, veneers on the top.
Veneers on bottom, veneers on top. Now look at the lower on the after, and
perfectly straight.
This is her after, and she's basically
she's like a model.
Soccer mom actually, and she's like so happy. You know, she's got 2 great kids. She's basically so happy about her smile. And,
so this is a subtle change.
This is a subtle change, but you know that small difference made a big change in her life, in her smile. You know, and cosmetic dentistry is not for everyone, but that smallest change that can make a big difference in your smile and can improve your life. It's like
she's a knockout now.
I mean, you look at these teeth. You know, a lot of people are concerned about veneers. Maybe it's going to look too long. They're going to look like a horse.
Well, I feel like I could spot them 10 yards away.
I mean, it all depends who was
That's in the hands of the dentist?
The dentist and the lab technician has a lot to do with it. Let me show you this next patient. Basically, she's a student and she wasn't happy with her smile. As she was biting, you could actually see her tongue because she
So that's with her mouth closed?
Yeah,
right
that's with her mouth closed.
What's that called?
We call it open bite. So the patient had extreme open bite, and it was pretty complicated to get the ideal bite, but that's all I do. That's,
all right.
You know, we do a lot of full mouth reconstruction. We come up with the ideal bite position. And here's her after, and she was thrilled and she was so happy.
Huge difference.
There's a difference between what she looks like now.
That's right.
I mean, she looks like, you know, she wants to go and have a party or
yeah,
fun,
she's like,
you know?
yeah, like
she's all happy and she's smiling and everything, comparing to what she was before, and she wasn't smiling before.
Well, she looked like very young there, like a kid. Now she looks like a woman.
You know, I mean, don't you think this
so it is life changing?
His life changed a lot. You know,
it
has a big impact. You know,
did they tell you that people treat them differently?
People treat them differently. People, you know.
Did they say that?
You know, they're more respected. Let me show you another one. This patient, he was actually a management of a big firm, and he was never smiling. And I know it looks pretty nasty, but
looks pretty bad.
Know, it looks pretty bad.
That's gotta be rare,
you know,
though. That's rare to see something like that.
No, it's not rare at all. You know, there are a lot of people out there who are not smiling. So
you just don't see it. I guess we don't see it.
I guess, yeah, you don't see it.
So he comes to you.
And what happened is after we placed 2-3 implants on him, and we went ahead and did a full mouth reconstruction. 3 weeks after we did the full mouth reconstruction, he got a promotion at his job. So
is that right?
I mean, it made a huge difference in his.
I think when we show those side by side on the screen,
you know,
a huge difference.
It's a huge difference.
Something to be very proud of. And so what do they say? I mean, they call you Dr. Golpa?
They tell me about the stories. You know, they tell me about what happened at their jobs. You know, how their smile affected their job and their social life, their personal life, their health. And this guy's jobs was affected in every way. He's dating now. He wasn't dating before. One of my favorite patients, she was a owner of a big mortgage company, and this is her bite, her close-up shot. This is with her mouth closing, actually. So the only thing was touching was the back molars. I mean, look at her. This is her bite.
So this little side view.
This is a side view. Her mouth is actually closed. And I mean, look at her face. She's such a nice lady. She's so happy. You can see that. But you can't see it on her face.
So she just doesn't smile.
And
is that what she tells you?
She has over 145 employees. And who would, I mean, she wouldn't be able to.
So she was insecure about it.
Yeah, she was so insecure about her smile. And look at her now. This is after doing a full mouth reconstruction and closing the bite.
I mean, a woman like that, successful, puts it off, doesn't do anything about her smile. Is it just fear of the dentist, the pain?
Well, one thing is fear. First of all my procedure gets done under IV sedation.
IV sedation, okay.
And if they want deeper sedation, we do have an anesthesiologist on board that comes in.
Okay.
So that is, they will not have any recollection of, you know, the surgery. But this patient didn't think anything was possible for her. She did have the money, but she didn't know if there's any option available for her. So she was
she just felt her teeth were too far gone?
Was too far gone, and there was too much decay, and her bite was an issue. She thought she might need some advanced type of oral surgery done to her jaw.
I mean, when you saw her on that consult, I mean, and you say you consider yourself an artist, do you see the end result? That means when you look at her,
I see the end result. See what we do. We do take a before mold of the teeth, and we do study model on these teeth to see exactly how the teeth is going to look like before we even do anything.
So the patient's in on the process.
The patient is in the process.
There's no surprises?
There is no surprises. We don't like surprises. So
you show them like charts or teeth models?
It's just like doing the surgery, doing the process before we even do anything. So we know exactly on the model how the teeth is going to look like after we're done.
Now they get temporaries. I mean, veneer patients get temporaries.
They get temporaries. And that's going to be a good study guide for us to see exactly where we're going, you know, if we are on the right track.
So when they look at themselves in the mirror, like a woman like this, sees the transformation in the mirror, do they get teary-eyed or choked up?
I mean, I got a few patients that cried after we put the teeth on because of happiness. They were so happy now they could smile. I mean, she wasn't smiling for over 60 years.
Really?
because of her teeth. So, I mean, it made a huge impact in her life. Randy, you're going to love this next one. Okay. This is one of my favorite. He's an extremely nice guy.
Is that him smiling, trying to show us?
That's him smiling. You know, he's a big executive of a big, huge company with thousands of employees that he manages. And these are his teeth, you know. His teeth are all worn down.
They're so short.
It could be due to stress, but these teeth were very short, and his bite was completely overclosed, and we went ahead and corrected the bite. This is what his after looks like.
Wow.
After we corrected the bite and placed all ceramic crowns on these teeth, you know. Look at his face. I mean, his headache went away, his TMJ is gone, his no more soreness of the jaw, no more migraine headache, no more jaw popping. I mean, he is so happy.
Is this one of those things where the patient says, Dr. Golpa, I should have done this years ago?
Yeah, I mean, they wish they would have done it a long time ago, because they wouldn't be suffering for all these years.
Is that your message? I mean, anybody, if you don't like your smile, you could do something about it.
You could do something about it, right, exactly. Not only you will improve your smile, but you will improve your lifestyle, plus, you know, if there's any headache or
those things will go away.
Those things will go away.
In many cases.
Everything needs maintenance, just like a car. It needs maintenance, you know.
Fix it up.
If you have to fix it up. If the jaw position has changed over the years, you know, we can bring it back to the ideal position where it used to be.
Now, we're just about out of time, so we have time for one more.
Oh, okay, good. This patient, she came to me, she is a model. She was concerned about the front gap and gadgety front teeth, and so it was a pretty simple case, you know.
I mean, when you look at that, that's easy?
That's easy, you know, but you have to have, you know, you look at the lip line again, you know, you have to have the eye of an artist to see what's missing here or what can improve this patient's smile. So, and these are her after.
Wow.
We went ahead and widened the arch slightly, lengthened the front teeth. The teeth looks completely natural. We look at the facial ratio to the teeth ratio, and she has a beautiful smile. She's actually on a cover of a magazine in Ukraine.
What about the process? What can somebody expect? Okay, they don't like their smile, they go in, they meet with you on day one.
They meet with me.
How do you decide what their teeth are going to look like?
We basically, the initial visit, will take an impression from their teeth. And, you know, we do a study model on them to see exactly how their teeth is going to look like.
What do they ask you, by the way?
Well, one thing they're mainly concerned about is the shade. The shape, you know, we have smile catalog. We want to go.
So you actually go over catalogs with them?
We go over different smile guide. You know, we go over different smile categories that, you know, that would fit their face.
Do they pick their smile?
I usually pick their smile for them. They usually leave it up to me, since I deal with them every day.
All right.
So they leave that up to me. But as far as the shape, the shade. Usually they have a lot of input into it. You know, I give them my input, and they'll give me their input, and then we'll decide what shade would look good according to the color of the skin. I give all the instruction to the lab. We get the model back from the lab, and then we'll go over the model with the patient on the second visit.
All right. So second visit.
Second visit, they'll review the model. Third visit, which is the main appointment, we'll prep all the teeth. And they will get a temporary, which is exactly...
So what is that made out of? So they get
temporary is made out of acrylic, which is basically, it's like another study guide for us, you know, it's just...
So they can eat with it?
They can eat with it and everything.
What if they don't like it? So I mean, is this a good time where they say, hey, they're too big?
That's a perfect time for us to decide if you like the temporaries or if you don't like the temporaries, because that's what's going to, you know, that's mimicking...
Do you ever see their teeth, they love it, you go, I don't know, maybe...
Yeah, there's a lot of times that they love their temporaries, but there's something I don't like about it. I make the changes, and then they see it, because...
Are you a perfectionist? Do you consider
I'm
yourself?
extreme perfectionist. I have to love it before they love it.
All right. Oh, really?
So I'm much pickier than any patients, because it's my work that's going to be going out there.
So in a perfect scenario, what's the timeline?
The timeline, basically, when they come in for the initial visit, from the time that they come in till the time we finish the process, it shouldn't take more than 3 weeks.
So 3 weeks, they could have a great smile. So from right now, them watching this in 3 weeks?
Yeah, we're looking at 2 major appointments. One initial visit that they come and see me. Second 10 minutes visit for them to see the model, to see how the teeth is going to look like. But the main important thing, to see exactly how the temporary is going to look like. If they like the temporaries, I like the temporaries, then we move forward. So there is no surprises at the end. Everything's everything is calculated. We know exactly how the veneer is going to look like. We have the shape, we have the shade, which...
so porcelain veneers, right, we're talking about. They're made of glass, right? That's glass.
They're made out of ceramic, right?
They don't
stain.
They don't stain.
Because they're impressed. They call them impressed veneers.
What about you? You have beautiful teeth. Can I ask you? I mean, do you have a few veneers?
I get few
Let me
veneers.
see you smile.
I get few veneers.
All right. No, but seriously, the fears they have. I mean, what are they afraid of? Or misconceptions out there about veneers that you could lay to rest right now?
The misconception about veneers is basically they're afraid they're going to look fake.
Yeah.
They're afraid they're going to look like a horse teeth. They're afraid about they look too bulky.
Yeah.
Or too short, or
and that's
whatever.
The hands of the dentist,
and
you're saying.
That's basically depends on the dentist. It depends on if there's. I don't think every dentist has an eye of an artist. Patient should look for a dentist who's actually does this full time.
Like that's their practice.
Emphasizes only on cosmetic dentistry. If they do full mouth reconstruction, and if they do implants. So if my practice is only limited to a full mouth reconstruction, which basically consists of cosmetic and implants. So
so there's no recognized specialty cosmetic dentistry.
There is no recognized.
So I guess it's tough for the public how to find a specialist.
You have to look at their background, you have to look at their reputation, and you have to look at their how many cosmetic cases they do per month.
You've done thousands though over the years?
I've restored probably over 20,000 restorations of veneers and
Is there a
glass
steep
crowns.
learning curve with cosmetic dentistry?
There's
what does the public need to know?
There is definitely a curve, and it basically doesn't happen overnight. It takes years and years of practice
to get better.
To get better and better, and to be a perfectionist.
Is that something you should ask your dentist though? How many veneers have you done?
One thing, you have to find out how many veneers they've done, and if they show you an album, if there's actually their own patients that they're showing you.
Okay.
So those are the main things that you need to look for. So.
Okay. In your office, by the way, it looks like an artist's office. I mean, it is really nice.
I wanted to make it different. I just wanted to not look like a dental office, so that's why I made it that way.
I want to thank you for coming to the show.
Thank you so much, Randy.
Always a pleasure to have you on the program.
Thank you so
much. You've been
much.
watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.